Assalamu alaikum, hello and welcome to another episode in our second series of The Health Show, here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert who discusses the prevention of health issues that we or our loved ones may face. Many of these issues are caused by an unhealthy lifestyle, so we're going to look at how you can change your health and lifestyle for the better. We'll also be inviting patients to our studios, and we'll be talking in depth about some of the issues they've faced and, most importantly, how they were able to overcome their problems with the help and support of an expert. So if you suffer from depression, obesity, diabetes, arthritis, or have a lack of fitness motivation, or if you know anyone who does, then tune in each week, as these are just some of the topics that we'll be covering in this series, as we offer an alternative viewpoint from our health experts. If you'd like any further information on our programmes or topics, then please do get in touch. healthshow@islamchannel.tv. On today's show, we're discussing stomach cancer with Dr. Nick Maisey, who is a consultant medical oncologist at the London Clinic Hospital in Harley Street. Dr. Maisey is a specialist in the treatment of gastrointestinal cancer and is the principal investigator on a number of national clinic trials, as well as the commercial studies that he's involved in. He has also held a number of key roles in private and NHS cancer care, including service lead for colorectal cancer, vice chair of the upper gastrointestinal tumour working group, and the medical director for the South East London Cancer Network. Dr. Maisey, thank you very much indeed for joining us.
Alistair, thanks for inviting me.
It's great to chat to you, but we'll talk a little bit more in a while. But first of all, world leaders have gathered in Mexico City in November 2017 at a special cancer summit. There they were criticised about the high cost of oncological treatments and agreed that social and economic inequality contributes to mortality. Let's take a look.
Podemos reducir la morbimortalidad por cáncer. Sabemos también que la enfermedad es tema de médicos, pero la salud de nuestra gente es tema de todos, de los médicos, de los gobiernos, de la sociedad civil organizada. Y no habrá sistema de salud en el mundo que pueda pagar el alto costo de los tratamientos oncológicos como lo estamos viendo hoy en día.
En México, estamos trabajando para reducir la exposición a los factores de riesgo asociados con el desarrollo de esta enfermedad, disminuir la mortalidad de la población afectada y mejorar la calidad de vida de los pacientes.
On how cities can drive change forward, contributing to our shared ambition to reduce the cancer burden for future generations.
It was fascinating watching that video, and the one thing that is clear is that wherever you are in the world, cancer treatment is very expensive, isn't it, Dr. Maisey? Is there something that we can do in terms of maybe avoiding the treatment in the first place so that we don't have to go through such great costs?
I think, Alistair, that's the key issue, is that much of the cancers that we see, including stomach cancer, are largely preventable. And they are largely based on lifestyle factors that are to do with education and change in lifestyle that can make a big difference to patients and can avoid cancers in the first place.
Well, certainly that's good news that it's avoidable. Let's go back to some basic things first of all. Stomach cancer itself, how prevalent is that in British society at the moment?
So in the UK, it's one of the less common cancers. It probably occurs in about just over 6,000 cases every year in the United Kingdom. And interestingly, actually, that's dropped quite dramatically over the last 20 or 30 years. And it appears that it's shifted more to a cancer of the lower gullet or lower esophagus rather than the stomach. But it still presents a major issue for patients in this country.
And you were saying it's predominantly caused by unhealthy lifestyles. Are there any other ways that one can contract it? Could it be genetic, for example? Do you have a predisposition towards it at all?
So there are cases of genetic stomach cancer, but they're actually incredibly rare. The vast majority of stomach cancers that we see are due to identifiable factors, largely due to potentially to diet, to smoking, but also there is an association with a bacterial infection in the stomach called Helicobacter, which is more common in areas of poverty. And that's largely probably why in the UK at least the incidence has dropped over the last 20 or 30 years.
So what would be typically the initial signs that someone is aware that they might have something like stomach cancer that would cause them to go and see their doctor or GP?
Unfortunately, actually, most patients have very vague symptoms that take quite a long time to be identified, and that's why still the majority of patients that we see with this cancer have relatively advanced cancer by the time they're diagnosed with the disease. But the kind of symptoms that people should be aware of are things like unexplained weight loss, symptoms of indigestion that don't go away with simple medicines, and weight loss for no explained reason, and symptoms like tiredness that they can't explain as well. And if they have any of those symptoms, really, they should be going to their GP to ask some questions about, is there anything going on here?
Is it something that could come up in regular checkups, or is there a screening program, or is there anything that people can do to, if you like, give them a bit of a head start on this?
So unfortunately, there's no standard screening program for this type of cancer, although there is obviously for other types of cancer. And the reason for that is because it still remains a relatively uncommon cancer, and we haven't identified a clear way to screen for these patients. There's a lot of interesting work going on which is looking at very simple breath tests that may pick up early cancers, but it's still very much in the experimental stage at the moment.
And of course that will be great news, especially for countries that we saw like Mexico or something, if they're able to see in advance. If you do pick it up early enough, can you avoid treatment, or is it pretty much going to be an operation that you're going to have to undergo?
So most cases of stomach cancer, even if they're early, will involve an operation. However, there are cancers that lie slightly higher up the gullet, just above the stomach, that can be dealt with via what's called an endoscope, which is a tube that's put down the throat, and the cancer can be removed without a major operation.
And what about the traditional methods such as radiotherapy and things like that? Is that what you would normally expect to go through as well?
So certainly in the more advanced cases of this cancer, surgery is often given in conjunction with chemotherapy and radiotherapy. Sadly, there are cases where an operation is no longer possible, and it may be that the patient has a cancer that's too far advanced for a curative treatment. But even in those cases, chemotherapy can offer some help and can certainly improve the prognosis of the cancer.
And what about the age groups which are more predisposed towards this? Is there a certain age where this is particularly common? And what about different ethnic groups? Is there any pattern there at all?
Well, again, interestingly, this with stomach cancer, it appears to be a disease of older people. So patients usually are in their 70s and 80s. For cancers in the gullet, actually that age group is a little bit less. It's sort of late middle age, 50s and 60s, which seem to be most commonly affected. In this country, it's usually actually most commonly is white males, is the most common ethnic group actually in this country.
And coming back to what you said originally, which was great news, the fact that actually we can do something about it. So what are the things that people are typically doing which can lead to these diseases?
So diet is obviously a big factor, and what we see actually is that a diet that's high in salt and low in vegetable and fruit seems to predispose people to this type of cancer. Smoking is another big factor that we see, and there's absolutely a link with smoking and stomach cancer. And it's been estimated that about 3/4 of stomach cancer probably has some lifestyle factor behind it.
And there's a lot of advice available for people in terms of what they should or shouldn't be eating. But essentially, you touched on it there a little bit about some of the foods and salt and things. Could you go into maybe a little bit more detail and give some examples of the types of food that really maybe we shouldn't be having that much of, and we should be increasing in a different type of food?
Sure. I mean, the advice for the NHS advice really is around a diet that's high in fruit and veg, so 5 portions of fruit or vegetable during every day. Avoiding adding salt to your cooking, avoid many of the food that you can get from supermarkets that already has a high content of salt, and there should be already signposted on the foods that you're buying.
So salt is a real key factor.
It is, yes.
And what about your weight? If you are more overweight with a higher BMI, is that an indication that you're more likely to suffer from it?
Potentially, but the evidence for obesity linked to this type of cancer is probably stronger in the cancers of the gullet, where there's a stronger link with acid reflux, that tends to occur with weight gain as well.
And then, of course, the thing we hear all the time is exercise.
Yes.
Is there any relationship between exercise and stomach cancers?
So there's not been shown a direct link, but there's no doubt that keeping healthy exercise, which doesn't mean going crazy and going to the gym 10 times a week, but just simply going for a walk twice a day. With most cancers, there is certainly a less incidence of cancer if you keep fit and healthy.
For many people, they might be thinking, you know what, I've been like this for ages, is it really going to make a difference at this stage? Is there a point where actually, don't worry anymore, it's okay, just go for it, enjoy your life and whatever?
No, absolutely. I mean, I think there is always time to change, and it will always be of benefit. Clearly, if you've had an unhealthy lifestyle for many, many years, you're not going to turn that around in a week. But there's very good evidence that actually changing your lifestyle, even at an older age, will make a difference.
We've seen a lot in the news about processed foods and, if you like, TV dinners and things like that. Obviously, there's a link to salt in there. Is there anything else about those types of foods that, again, might be problematic?
So, again, a high fat content, processed meats. There has been a link with processed meats and this type of cancer as well. So, absolutely. And I think, as you say, the sort of TV dinner scenario is certainly one which you should avoid if possible. Home-cooked food, lots of fresh vegetable and fruit is really the key here.
And I liked your tip there about reading the packaging.
Yes.
Because that has seemed to get a lot more clear these days, so people have got a rough indication. Give us a little bit of an outline of the labelling these days, and how it's changed and what we should be looking for.
So I understand that in the supermarkets they're now obliged to label the foods with some of the key ingredients, including, as we discussed, salt, sugar, and fat. And I believe they use a traffic light system, so we're green, orange, and red, and obviously avoiding anything that's got a high content of fat, sugar, and salt is the way to go.
Because it's quite interesting, isn't it? Sometimes they'll say it's a diet food, but then they load up with something else. So it's important to read the whole label and make sure that you're not just saving on one, but then piling it into another direction.
Absolutely.
And what about sugar? Again, we hear that being very much a topic when it comes to weight, but is that related to stomach cancers at all?
So there doesn't seem to be a direct link that's proven between sugar ingestion and cancer, or this type of cancer, but clearly the link to obesity and the increased incidence of cancer as a result of obesity seems to be the way.
It's funny, isn't it? Because we all see the news reports, we all see the various TV shows like this one telling us that we've got to be more healthy, but somehow it's still not getting across. It was positive news that you said it is reducing a bit, but actually not at the speed it should be given the information age in which we live in. What do we need to do, or what can government do to make sure this message is getting across?
So, I think it's a message that just has to be said. I think a key thing that people maybe don't understand is that you don't have to make a big difference to the amount of exercise that you do to make a big difference to your health. And you're simply talking about a walk a day. You don't have to be jogging around the park. It can be just small changes like that, but they'll make a big difference. Avoid being sedentary for too long. We're all guilty of it in our workplace. But get up once an hour, have a walk around the office, go and get a glass of water. Simple things will make a big difference.
You talked earlier on about it being predominantly a disease that affects older people.
Yeah.
What about children and getting them into the right habits and things? Because if you start a child off with bad habits, is that likely to continue and then accelerate the possibility of getting these problems?
There's no doubt that habits like that were formed very early in people's lives, and I think it's really key that it's a role for parents and for schools to really emphasise the benefits of keeping active, keeping healthy, getting a good diet. And I think if you start early, it really leads to a change for the whole of the lifetime.
A lot of research is always taking place surrounding cancer and the different types of cancers. What are some of the things that we can see on the horizon when it comes to stomach cancer in terms of improving people's ability to survive such cancers?
Yeah. I mean, as I mentioned before, there's a lot of interest in looking at picking up early cancers, and that's got to be the key to changing this dreadful disease, because there's no doubt if you can diagnose a cancer at an early stage, you have a much higher chance of cure than if you pick up a cancer when it's more advanced. So there's a lot of work going into, as I mentioned, the breath tests, which are a way of screening a population to see if anybody potentially could have cancer, because we don't have anything like that at the moment. And looking at ways of removing early cancers without a major operation. There are situations still, unfortunately, where people do have advanced cancer, where we know that surgery is not going to cure them, and in that sphere, there's a lot of work going on developing some very sophisticated medicines that help people to live longer and live a longer normal life, even though they've got their disease.
What it typically, if it hasn't been at the very advanced stage, what's the sort of prognosis for most people? What's the survival rate? Because people always, we've got better, haven't we, with cancer, to see that actually it's not the same sort of dreadful consequences that we once thought. But how does cancer within the stomach rate compared to other cancers, and what sort of survival rate is there?
Yeah, it's still a very challenging disease, and even in cases where we can operate, and as far as we can tell at the time, there's no sign of spread of the cancer. After an operation, the cancer will return in about half of those cases. So it's still very challenging. So as I say, I can't say it enough. It's really about early diagnosis, because the sooner you can pick it up, the better your chance. In the UK, certainly survival for this cancer has improved over the last 20 or 30 years a lot. And a lot of that really is down to the way that teams work together as well, because it's now become a standard way of working that we once a week will meet with the surgeon, with the whole team, the radiologist, and work together and discuss each case and see what's the best way forward.
Britain is often seen, isn't it, as the centre of medical excellence. When we look at all of the work that's been done at the London hospitals, such as Guy's and St Thomas's, but also throughout the country. How are we doing compared to other countries, say in Europe and around the world?
Yeah, I mean, this is quite controversial. I mean, I think we have actually an excellent system for cancer in this country, and everybody has a great opportunity. The statistics often quote us being lagging behind, certainly in the European polls, in terms of survival from cancer. But we're not really clear whether that's a true reflection, or is it that we're very good at collecting the information and that just makes us look a little bit worse. But certainly, there are other countries, so often people look to the States, for example. And yes, in the States you can get absolutely fantastic medical care, but you can also get very poor medical care. And in the UK, actually, we're very lucky that everyone has access to I'd say, a good level of cancer care.
Because, when we look at the universal healthcare system that we have in Britain, we get people from all over the country. And one of the things that we're seeing more and more are different hospitals becoming areas of excellence in whatever they do. And certainly, Guy's and St Thomas's, how are you in that sort of league in terms of cancers and those type of treatments? Is it something that you particularly specialise in, or is it something that is maybe in other parts of the country?
So one thing that's really come out very strongly in the last 20 years or so is that it's critical that if you're dealing with a rarer cancer, that you really need to concentrate the expertise in one or two sites. And so the surgeons, for example, really need to be operating on at least 20 or 30 cases a year to build up that expertise. And there's no doubt that if you go to a surgeon who only operates once a year on a particular cancer, the outcomes will be much worse. So in the UK, we've done that very successfully, in that we've really concentrated the expertise in in limited sites, and that's really pushed up the survival rate from cancer.
And again, let me to add to the voices of, what an amazing institution our NHS is, and the fact that we can do this. It's something, as you say, we bash it occasionally, but actually underneath we've got a fantastic system, and it's working really well.
Absolutely.
We're going to talk a little bit more in a while, but at the moment it is time for a quick break. But what we should say at this stage is we must stress that should you suffer from any health concerns whatsoever, it's always highly recommended that you contact your local doctor or GP first, as the Health Show gives you an alternative viewpoint to the health issue being discussed by our experts. Don't go anywhere, we'll be right back. Welcome back to the Health Show, where our topic today is stomach cancer. So far, we've discussed the causes, symptoms and treatments. But can technology play a part in its cure? Well, a British surgeon live-streamed footage of a recent cancer operation using virtual reality technology in what he said was a world first that would help with training and allow doctors to advise on operations remotely. The virtual augmented reality operation was performed by surgeon Dr. Shafi Ahmed on a patient with colon cancer. Assalamu alaikum, hello and welcome to another episode in our second series of The Health Show, here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert who discusses the prevention of health issues that we or our loved ones may face. Many of these issues are caused by an unhealthy lifestyle, so we're going to look at how you can change your health and lifestyle for the better. We'll also be inviting patients to our studios, and we'll be talking in depth about some of the issues they've faced and, most importantly, how they were able to overcome their problems with the help and support of an expert. So if you suffer from depression, obesity, diabetes, arthritis, or have a lack of fitness motivation, or if you know anyone who does, then tune in each week, as these are just some of the topics that we'll be covering in this series, as we offer an alternative viewpoint from our health experts. If you'd like any further information on our programmes or topics, then please do get in touch. healthshow@islamchannel.tv. On today's show, we're discussing stomach cancer with Dr. Nick Maisey, who is a consultant medical oncologist at the London Clinic Hospital in Harley Street. Dr. Maisey is a specialist in the treatment of gastrointestinal knowledge as well. Is there normally quite a good spirit within the medical profession worldwide to share knowledge to make sure that everyone's up to speed?
Absolutely. I mean, in various specialties, there are international congresses that happen at regular intervals throughout the year. And there's always a very strong international presence at all of these meetings. And a lot of the early data is presented to an audience who can then take that back to their own countries and benefit from that.
I mean, it's lovely to be first, of course, but then it's great to be able to then share it. And looking at technology, how much more do you see technology being involved in healthcare and specifically with cancer treatments?
It's a huge area for development. I mean, there's been absolutely massive changes in terms of the way that we use radiology, for example. So the use of very specialist scans, Positron emission tomography, for example, is a technique that allows us to see active cancer.
I think you better explain that one.
Yeah, so it's a specialist type of scan that shows us where active cancer is in the body, and that allows us to better tailor our treatment for those patients, where before we wouldn't know whether there were active cells in a different part of the body.
Of course, the danger with all of this can be that people think, you know what, I'm going to abuse my body, I'm going to eat whatever I want, because actually by the time I get to that age, technology will have caught up, we'll be fine.
Sadly, it doesn't quite work like that, as you know. And I mean, there's huge advances, but we still, as with stomach cancer, have challenges in curing this type of cancer, particularly if it becomes more advanced. I hope there'll come a day where we can change cancer into a chronic disease, a bit like we have with many other diseases. We're not quite there yet, but there's a glimmer of hope, and there are certain types of medications that are being developed that look like they could have an impact on that.
Now, I know you do a lot of work with Guy's and St Thomas's, but you're also very active with the London Clinic. Tell me a little bit more about your role there and how you manage to divide your time between everything.
So I spend about a day a week at the London Clinic in my private practice, and I work in a group of oncology clinicians. And we essentially treat patients with various types of cancers. The London Clinic's a great institution because it's a hospital with a great commitment to cancer. They've built a dedicated cancer centre, and we have access to the latest technologies, which sadly aren't always available in our own NHS system, as good as it is.
And one of the things that London has become famous for is many people coming from all over the world because they see London as a centre of excellence when it comes to medical care. So do you find we do get a lot of people coming from other countries to the London Clinic?
Absolutely. I mean, there's a very, very strong presence of patients from the Middle Eastern countries who come to London specifically for healthcare and no other reason. But from all over Europe and all over the world, actually, people come to central London for this kind of expertise.
And doctors like yourself are working hard to make sure that Britain stays at the top of the pile, as it were, when it comes to the research and knowledge and treatment.
Absolutely, and I think it's a compliment to the NHS as well that actually the NHS has produced a huge amount of expertise in clinical research as well as clinical day-to-day work. And I think people come for that. They know that the training is second to none, and that, as you say, our research portfolio is very strong in this country.
We've been focusing on stomach cancer today, but how does that relate to other cancers? I mean, is it something where if you get stomach cancer, obviously in an advanced stage, it can spread, but if you have a tendency to get that, is there then a likelihood to get other cancers or other diseases?
So, not particularly. There are some very rare syndromes where you can get multiple cancers if you have an underlying genetic problem that predisposes you to that. But again, most of the risk factors for stomach cancer would be the same for other types of cancers, albeit whether it's lung cancer or bowel cancer. So there is a higher risk if you engage in some of those lifestyle factors we talked about earlier.
Exactly, and again, we talked about the foods that we should avoid, and I'm definitely going to cover that again before the end of the show because that's clearly the real crux of this. I want to talk now a little bit about the aftercare. If somebody is having to go through an operation, first of all, with the modern technology, how invasive is that operation? You talked a little bit about some of the different things you can do, and then what happens in the aftercare process? How does that take place?
Sure. I mean, it's a major undertaking. Obviously, removing someone's stomach and then recovering from that is a major operation. But incredibly, people after that type of surgery are eating and drinking after only a few days after that kind of operation, and often are out of hospital in 10, 14 days in most cases. It can be a life-altering operation, though, and people will take several months, if not a year or two, to recover, and may be left with ongoing problems such as absorbing certain vitamins and iron in their diet as well. So it's very important that the aftercare is ongoing to monitor the dietary aspects of the patients and make sure that they're not suffering from any ongoing results of surgery or indeed chemotherapy or radiotherapy.
And again, you said earlier on that sadly about half of the people who have an operation will get a reoccurrence. So is there anything that they can do with their diet? Obviously all the things we've talked about earlier on in terms of the food. Is there anything that's specifically good for maintaining really good stomach health, especially for those people who have maybe, because there might be viewers watching at the moment who are in that period where they've just had the operation. It's so far so good, but they want to do their absolute utmost to ensure that it doesn't reoccur.
I mean, it's much of the same advice, but actually in this area, this is where exercise is really important, because we have seen quite clearly in many cancers that keeping fit actually reduces the chance of a cancer coming back. And that's been shown in a number of different clinical studies. So keeping active, keeping fit, sticking to that healthy diet, those are the key things.
And obviously there's a lot of aftercare from the medical teams as well, going back. So in those situations, would they then be screened regularly? Is it through blood tests or is it through x-rays, or how would that be done?
So there's a very intense follow-up period after this kind of surgery. It usually lasts for about 5 years after the initial operation, and it'll be a combination of blood tests, clinical examination, and regular scans as well in most cases. But after 5 years or so, your chance of the same cancer coming back are usually so small that you don't need that kind of intensity anymore.
I'm always intrigued when we talk to people from the medical profession on this show about how someone gets to specialise in something which is, it's quite a sort of specific area of health. How did you get involved in oncology, but more specifically into stomach cancers?
It's a good question, and as most things, it was probably by chance. So during my medical training, back in the sort of mid-90s, I was doing a number of different jobs at that time. And I happened to do an oncology job, and it was the first time, I think, that I really got to know my patients really well, because the same patients come back on a regular basis, and you get to know them, and you get to know them as people, you get to know their families, and actually it's very rewarding, and actually you feel that you're giving a lot to that patient. So that was the first thing that really attracted me to the specialty. After that, I was lucky enough to get a training program at the Royal Marsden Hospital. And it was really my mentor there who influenced my decision to specialise in this particular type of cancer.
We talk a lot about the research that's going on, and there's some wonderful charities out there doing some fantastic work. How much more help do they need? I mean, is it a matter of money here? Is it a matter of just waiting for time and technology to catch up with each other? What's holding us back at the moment?
I think it's in some cases it's because the cancers are genuinely very difficult. I think that actually drug development is actually very hard and very expensive. If you can imagine that when you're developing a drug, if you have 100 drugs that you develop, only about 5 of those drugs will ever get a license at the end of the day. So that's a huge amount of investment, time and money actually to develop a drug that may or may not be effective. So I think it's about also our knowledge increasing about how the biology works in these cancers to help direct that research too.
We're reading a lot in the papers about, certainly when it comes to certain drugs, that we're almost building up a tolerance towards some of those things. Is that true?
Well, certainly we see that with standard chemotherapy drugs that we use in the clinic. A patient may be receiving chemotherapy and doing very well, but there does usually come a point where the cancer develops a resistance to those drugs. The really fascinating change that's happening at the moment actually is research into what we call immunotherapy. And these are a family of drugs that actually allow or enhance our own immune system to recognize cancers. And that's an area of research that's looking incredibly promising. And hopefully over the next 5-10 years or so, we'll see a lot more drugs coming through that actually augment our own bodies in fighting cancer.
I want to come back a little bit now to people who may be concerned that they might have it. We talked about the fact that screening isn't really a viable option at this stage, or it's certainly in the very early stages of that. If someone is concerned about a loved one and they're watching them and thinking something's a bit different, you talked about weight loss, you talked about sort of maybe not getting over indigestion as quickly. Is there anything that some other people might observe in an individual that might give an indication that they need to go and get checked out?
Yeah, I mean, I think if there's any reason that the person, their loved one, is listless, is less active, is looking a bit pale, is looking worried, I think obviously a chat with them and just try to tweak out what the issues are. But I think that little bit of gentle pressure to go and see the GP. As men, we're terrible.
I was going to say that. Is that still the case?
Yeah, absolutely. I mean, we know it's a cancer that primarily affects men, but we're superhumans and we can't be ill. So unfortunately, we're very bad at seeking advice. But again, it's a really important point, and we really should be encouraging, particularly males, go and see your GP if you're worried, if you have any new symptoms. It probably will be nothing. But if you catch something like this early, you really stand a good chance of curing it.
And that's always good news, and it's a great message to say to everybody, because we sometimes get, especially men again, get worried about, I don't want to bother the doctor, they're very, very busy, they're under enormous pressure, and I don't really want to add to their workload if I turn up as well. But doctors know who the infrequent visitors are and who the regulars are, don't they?
Absolutely. And there's nothing worse for a doctor to see a patient who actually has been struggling for months on end with really quite clear symptoms and didn't seek any advice, when actually, had they done so, we could have made a difference.
Let's come back to the core, really, of your advice here, which is how we can all take steps to actually improve our lifestyle. And this actually isn't just about stomach cancers, is it? It's about general health. There's so many different things. I mean, every guest we have on the show seems to say very much the same thing, that actually just a few basic measures can make a difference. If there's somebody watching and they say, but actually, you know, I've seen these programs and it's a mile away from where I am and my lifestyle, that's just such dramatic change in lifestyle, I'm not sure I can manage that. What would you suggest as those first steps, those baby steps to improve their health and lifestyle?
Yeah. I think the thing to remember is that you really don't have to make major changes to have a really positive impact on your life, on your chance of getting, you know, a disease such as cancer. So, you know, as I mentioned before, even just a walk a day, just changing your diet very slightly, all of these things, they seem like small things, but actually they really have a very positive impact.
Looking around the world, you know, at cancers, how are we doing compared with other countries in terms of, we talked about survival rates earlier on, but actually developing them in the first place? Because people often will look at our lifestyle that we've just been talking about. We hear often about the Mediterranean diet, for example. How much evidence is there to suggest that actually there's something that we actually do in Britain which isn't good, which is really causing a lot of the problems?
Yeah. So we mentioned earlier about stomach cancer, and actually that's going down in incidence. The cancer that's actually grown hugely in the last 20 years or so is what we call esophageal cancer, or cancer of the gullet. And unfortunately, in the UK, we probably have one of the highest rates in Europe. And that really does seem to be related to acid reflux, bad diet, obesity, and I think that's that's really important. That those are the key factors that we concentrate on.
And you talked a lot about salt. Why is salt such a bad thing? We hear it over and over again, but you've mentioned it on a few occasions now about stomach cancer. Why salt is so bad?
So obviously there are other diseases where salt is an issue, such as high blood pressure and cardiac disease. In particular, for this type of cancer, it's probably something to do with the environment in the stomach. That over a long period of years, if you change the environment within the stomach, the cells slowly change and they become more prone to changing into cancer cells.
So there is this thing about over a long period of time that actually you might think you're getting away with it, but actually you are sort of laying the roots, as it were, of trouble ahead.
Absolutely. So I think you mentioned, Alistair, earlier on, it's about lifestyle changes. It's never too late to make these changes, but if you can really instill them at an early age, you know, as a family, do the right things together, eat healthily, then it will, you know, it will make a major difference to you and to your family's health.
One of the things that it's been interesting talking to you is listening to the way the medical profession deal with new technology, new things coming along. What about the next generation of doctors? Do we still have that legacy of great health in Britain, where there's still a huge amount of people coming into the industry and showing the same level of interest?
Yeah, absolutely. I mean, clearly things have changed, and someone old like me in the profession will say, well, it wasn't like that in my day, but actually there's still a huge amount of talent coming into this profession, a huge amount of enthusiasm, a lot of clinical research still happening in this country. So I'm still very proud to be working, you know, in the UK, both in the NHS and in the private sector as well at the London Clinic. So I'm very optimistic. I think that, you know, within my lifetime, I suspect we'll see a major change in the way that we deal with cancers, with our increasing knowledge and our ongoing research.
But what would you like to happen that would accelerate our progress? What are the sort of things that you think? We talked a little bit about money. We've talked a little bit about actually us taking responsibility for ourselves as well.
Yeah.
What else is there out there that could be done?
So clinical research is really key, and I think it's traditionally in this type of cancer, it's been on below the horizon. People really haven't been that interested because traditionally they felt that this was a cancer that was so awful that we couldn't make any difference. But the only way we're going to change the outcome from this kind of disease is through research, through funding, through government agencies, but also embracing and working closer with some of the pharma industries to push forward on that research.
we're living in London in a very diverse community. Have you noticed the differences in healthcare as a result of the different ethnicities, different types of people who are in Britain? We've got this wonderful sort of mix of individuals, but has that changed the face of healthcare in Britain?
I think so. I mean, I think we see, certainly at Guy's and St Thomas's, a very broad mix of ethnicities in our clinic. We're tending anecdotally to see a lot of stomach cancers in Eastern European populations rather than sort of the UK population. So there are definitely pockets of ethnicities that have a higher incidence of certain cancers as well. So it's important, I guess, to target those populations and make them aware of their risks.
And again, that leads on nicely to the topic of education, which again we've talked a lot about. What more can we do? It seems every TV programme that we watch, there's something about healthcare, there's every magazine and so on. Is there anything else that can be done? Because somehow we're just not reaching some people, are we?
No, I mean, I think it's about trying to identify key people in the communities and maybe relying on them to push forward some of this information in a way that is more acceptable as well. So and we have to embrace the local communities, and we have to speak to the key people that people trust.
And it's always interesting with that because we see everything in different languages. There's a lot more openness about making sure that everyone is aware. What about the programme in schools, getting in early?
Absolutely. I mean, I think there is some work now going on in schools and getting kids aware of their health and how they can change it. But education is everything, and I'm sure if that needs to be pushed harder, then that should happen.
And of course, one of the things we see is that food is so cheap today, isn't it? And fast food is cheap, and the food that's not particularly good for us is very, very cheap. And I'm going to be a little bit controversial here and talk about some of the ideas that have been raised, like sugar taxes and fast food taxes and things. From a perspective of a medical expert, I'm not going to get into whether or not you believe they should happen, but what other ideas would you suggest that we actually think about if we were to start the whole process again and say, right, okay, we need to somehow attract people to eating better food? What are the sort of things we could do?
I'm a slight sceptic of sort of punitive measures, so I'm not sure that taxes are going to be the answer. Yes, they're part of that, but it worries me that a packet of cigarettes now costs £10 and people are still smoking, and that's a huge amount of money. So I think it is about educating and getting in early. I think that's the only way we're going to change people's behaviours, actually.
Well, hopefully people watching this programme will be the beginning of that, and we'll keep getting that message across too, especially with stomach cancer. We only have to eat healthily and better, and we can avoid a lot of it.
Absolutely.
Thank you very much indeed. It's been fascinating finding out more. But sadly, that is all we have time for this week. And we've heard some really important and helpful advice on stomach cancers and their treatment. Thank you again to Dr. Nick Maisey for coming in to the show and sharing all of this great information. If you'd like to know any more, then please do email us at healthshow@islamchannel.tv. We'll be back again very, very soon, but in the meantime, we should again reiterate that once again, we must stress that should you suffer from any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health issue being discussed. As I said, join us again next week. Thanks for being with us. Assalamu alaikum.